Hello, my name is Dr. Liam Hosie. I'm a GP in the centre of Wigan and my practice covers 2 large care homes. I also work with the CCG and local authority in helping to support all care homes in the borough. I'd like to spend the next few minutes talking to you about COVID vaccines, as I realise that some colleagues who work in care homes may have a few questions and concerns about the vaccinations. It may be useful to start with how vaccines work. You're probably familiar with vaccinations to help prevent many illnesses, such as flu, polio or hepatitis B. The COVID vaccine works like many other vaccines, that it helps our body's immune system prepare itself to fight off COVID if we become infected. The vaccine will not give you coronavirus, but it should give us immunity against coronavirus. A very valid question many people have is how the coronavirus vaccinations can be developed so quickly, and does this make them less safe? Normally vaccines and new medications take years to develop. This is because trials initially run on a few people, then a few more and so on. Because of the amount of resources and manpower that was committed to developing COVID vaccines, many of these trial stages could run side by side, making the whole process quicker. However, the vaccines were still tested on tens of thousands of people before they were made available for us to use. In these trials, no serious reactions were noted. At the time of filming this video, over 54 million doses have now been given in the United Kingdom, with very few significant problems noted. Some people have also been concerned about the side effects of the vaccine, both short and long term. As with many vaccines, there can be some very minor side effects in the first few days after having the jab. These include a sore arm, headaches, muscle pains, tiredness and mild fevers. In recent weeks there has been a considerable amount of media coverage concerning the risk of blood clots with the Oxford-AstraZeneca vaccine. We are fortunate in the United Kingdom to have a very sophisticated medications monitoring system, so even if a small number of problems are reported, we are aware of these quite quickly. By the end of April, 242 cases of blood clots associated with the AstraZeneca vaccine were reported, out of a total of 22.6 million doses given. The problem with blood clotting seemed to be more likely in younger people, so as a result of this, the current advice is that people under the age of 40 will not be usually offered the AstraZeneca vaccine. It really is important to view the blood clotting issues that are associated with some vaccinations in the context of how we view risk. Currently, we estimate that around 10 people will get a blood clot for every million doses of vaccine given. Now compare this to some other facts. Blood clots are common. Around 1 in 1,000 people can have a blood clot without any obvious reason. A flight for over 4 hours, such as going to Tenerife, increased the risk of a clot to around 3 in 1,000 people. Being infected with COVID really does increase your risk of blood clots, especially in the lungs. A risk of death from a road traffic accident is around 1 person in every 20,000 people. In reality, none of us avoid car travel or flights because we're worried about blood clots or the risk of dying, so we do need to view the risk of blood clots associated with vaccines in this context. Another very valid question is, can the vaccine cause any long-term effects? As with any new vaccine or medication, there will be ongoing monitoring to see if there are any rare long-term adverse effects. What we do know, however, is that COVID infection itself can have significant long-term effects in some people, often who have been previously healthy. These effects can include breathlessness, headaches, tiredness, blood clots, heart problems, depression and digestive problems. I have a number of patients who have had COVID and work in healthcare settings who have not been able to return to work for a number of months, which is obviously a significant burden for them, both physically, mentally and also financially. Some people have asked, do they need a COVID vaccination if they've already had COVID themselves? The short answer to this is yes, they should be vaccinated. We simply do not know if a previous episode of COVID infection will stop you from getting a further COVID infection, or indeed if it will stop you from becoming very ill if you do get infected again. A very common query that has caused worry for many care home staff was the suggestion that vaccinations can have an impact on fertility. There really is absolutely no evidence to suggest that this is the case. Indeed, the doctor in charge of women's healthcare in this country says there is absolutely no mechanism by which the COVID vaccines can affect fertility. The guidance has also recently changed to support the use of COVID vaccines in pregnancy. And in the USA, where over 90,000 pregnant women have been vaccinated, we are not aware of any problems caused. There really are very few people who cannot receive a COVID vaccine. Initially it was thought that some people with allergies should not receive the Pfizer vaccine. This has changed as we've got more experience of using the vaccine. If someone has a severe anaphylactic reaction to the first dose of the vaccine or to a chemical in the vaccine, then they should not be vaccinated. Most people will be aware of having severe allergies. My advice would be to initially speak to your own GP, who will have access to your medical history and will be able to get further advice if needed. Equally, there may be a few rare conditions that predispose you to blood clots, which may influence which vaccine you are given. Again, your GP will be best placed to advise initially on this. Currently, there are 3 vaccines available: Pfizer, Oxford AstraZeneca and more recently Moderna. We currently think that we will need 2 doses of the vaccine 12 weeks apart to give us immunity. What is not clear yet is will we have to have boosters every year or so. We also don't know yet if we'll have to show proof of vaccination to travel or to attend events, but I know these stories have been in the media. The more people can get vaccinated, the better. This should reduce the number of people getting coronavirus, as well as reduce the chance of someone becoming very unwell with coronavirus. Care home patients and staff were the highest priority for vaccinations. They were offered the first doses available. This is because we know that when care home residents become ill with coronavirus, this will easily spread within the care home and can have devastating consequences for the residents. Therefore, by being vaccinated, you'll help protect your residents, your family and yourself. So to conclude, the vaccines are safe. The vaccines have really minimal side effects and have no effect on fertility. Most people are able to be vaccinated, and having a vaccination seems to be much better than potentially getting COVID. I had my vaccination as soon as it was offered to me, as did my wife, who is also a GP, alongside all the clinical staff I work with, including some who have had COVID infected already. My mum and dad, who are both over 70, have also been vaccinated. I really would not have a vaccination myself or encourage my family to have one if I had any concerns. Thank you so much for taking the time to listen to me today, and thank you again for all the work you do for the most frail and vulnerable members of our society. I do hope you will consider having your COVID vaccination. Please speak to your managers to arrange one, or speak to your own GP if you have further queries. Thank you.